Good afternoon and welcome to the VFC Compliance, Vaccine Storage and Handling webinar, the fourth session of our 2023 immunization updates. A couple of housekeeping items. You will receive an email this week with a link to an evaluation. Please complete the evaluation for your VFC certificate, which will follow soon. Be sure to check your spam folder, especially if you use Gmail. A reminder, all attendees must register individually to be eligible for the certificate. The slides are posted on the materials page, and there was a recorded VFC webinar posted on our events page. You'll find the links to these two pages in the chat box, plus my email address for follow-up questions. Please feel free to type in a question to the Q&A question box, not the chat. The facilitator for today's session is Kate Allen, Quality Assurance Analyst in the Vaccine Unit. Kate?
Good afternoon, everyone. My name is Kate Allen, and I'm the QAA for the Central Region, as some of you might know. I have the pleasure of introducing our presenter today. Presenting the VFC Compliance, Storage, and Handling webinar will be Dylan Kirby. Dylan is the Vaccine Management Unit Operations Coordinator. The floor is yours, Dylan.
Awesome. Thank you so much, Kate, and welcome everybody to this presentation this afternoon. To get things started, I would just like to bring your attention to our faculty and planner disclosure statement. And I would also like to say that I, Dylan Kirby, have no relevant financial relationships to disclose. So jumping in, we have a jam-packed agenda for today. We're going to go have an overview of the Vaccines for Children program. We're going to go through the guidelines for compliance with federal and state vaccine administration requirements. This is going to include everything from vaccine management to billing to vaccine safety to VFC site visits. And at the end of the presentation, there's going to be a couple slides with some additional available resources for you and your staff to check out. So jumping into it, the Vaccines for Children program was established by Congress in 1994 to increase vaccination for children who might not get vaccinated due to financial barriers. This federally funded program provides vaccines at no cost to children who might not otherwise be vaccinated because of an inability to pay. In general, how this works is the CDC buys vaccines at a discounted price and distributes them to grantees, i.e. the state of Massachusetts, who then in turn distributes them at no charge to private physician's office, public health clinics that are registered as VFC providers in the state. Children who are eligible, and we'll get into VFC eligibility in a second, for VFC vaccines are entitled to receive those vaccines recommended by the Advisory Committee on Immunization Practices, commonly referred to as ACIP. So what is VFC eligibility? So the VFC program serves children through 18 years of age, so anybody younger than 19, who meet at least one of the following criteria. They are enrolled in Medicaid, and this also counts if Medicaid is their secondary insurance. They still qualify as VFC eligible. If they are uninsured, if they are underinsured and seen at a federally qualified health center, or if they are American Indian, Native American, or Alaskan Native. VFC eligibility must be screened for every immunization visit for patients. Even if you saw the patient a week ago and they come in for a follow-up appointment, you need to screen for VFC eligibility, again, as VFC eligibility can change rapidly. Patient eligibility screening records should be always kept for a minimum of 3 years after service of the patient was completed. So if you see a patient on January 1st, 2023, those records must be kept at a minimum until January 1st, 2026. So now to kind of the meat and potatoes of the presentation, the guidelines for compliance. So the guidelines for compliance discuss the vaccine management and VFC requirements as part of the VFC program. These guidelines are found at our website, which is linked on this slide, and they also get updated annually. Usually these guidelines are updated near the beginning of January, so once you're getting into that re-enrollment period at the beginning of the year, it's always a great time to review the guidelines of compliance again to make sure you're up to date with all the changes that may have happened. So Massachusetts is a universal state, which means we universally supply all routine recommended pediatric vaccines to children through the age of 18, regardless of their insurance status. Children who are not covered by the federal VFC program, so they're not VFC eligible as through those four requirements earlier I presented, they're covered by a state trust fund. Massachusetts also supplies no-cost vaccines to uninsured adults seen at public provider sites. This might be a community health center, a board of health, or any of the other public provider site. All state-supplied vaccines can only be used according to the childhood and adult vaccine availability tables. These vaccine availability tables are also available for review on our website. It is very, very important that any staff member that is involved in administration of vaccines at your site is familiar with these vaccine availability tables, so they know which state-supplied vaccine can go to which patient and which patients might need to get privately purchased vaccines instead of state-supplied vaccines. Again, these availability tables are also updated on an annual basis, usually around January. Talking about VFC screening again, providers must screen all children at every immunization visit. This screening can also be documented electronically in your EHR system, and it must be, again, kept for a minimum of 3 years after service to the patient. So if you are tracking VFC screening in your EHR, you must have the following categories: VFC eligible Medicaid, VFC eligible uninsured, VFC eligible American Indian Alaskan Native, VFC eligible underinsured, and not VFC eligible. The use of any other options, whether they're state-specific eligible, local-specific eligible, names of specific programs, are not acceptable in Massachusetts. If your EHR does not align with these columns here, you'll need to contact your EHR provider to make sure they get that set up appropriate for you, so VFC eligibility can be properly tracked. The borrowing of state-supplied vaccines should be a relatively rare occurrence. Essentially, the current way it's set up, borrowing should really only happen for MenB vaccines because it's not a routine vaccine. Borrowing is defined as using a dose of state-supplied vaccine for a child that is not eligible for a state-supplied vaccine when privately purchased vaccine is not readily available, or vice versa. The really important thing when talking about borrowing vaccines is that you will need to fill out a borrowing report form. This borrowing report form contains patient identifying information. So that means this report form cannot be emailed. It must be faxed to the fax number found on this side. This is the fax number for the vaccine management unit. Borrowing reports, again, must be kept on file as part of the VFC program records for review during site visits, must be kept for a minimum of 3 years. And then again, for borrowing reports, it's really, really important that they are never sent by email and are always faxed over for patient confidentiality reasons. This slide here shows an example of what a borrowing report looks like. As you'll see in columns 4 and 5, that's going to be where that patient identifying information is contained. So again, you would fill this out completely and you would fax this over to the vaccine unit for processing in the event of borrowing. Now let's talk about fraud and abuse. So fraud is the intentional deception made by a person with the knowledge that it could result in some unauthorized benefit to themselves or some other person. Abuse is defined as provider practices that are inconsistent with sound fiscal, business, or medical practices and result in unnecessary costs to the Medicaid program, the immunization division, health insurance company, or to the patient themselves. Some brief examples of what fraud and abuse might look like in the VFC program is selling or misdirecting state-supplied vaccines, billing a patient for state-supplied vaccines, or charging more for an administration fee than is allowed, failing to account for state-supplied vaccines, or failing to receive, store, or use the vaccines appropriately. More situations of fraud and abuse can be found in that Guidelines to Compliance document in section A5. In some instances where state-supplied vaccines have been lost or deemed non-viable due to the provider's failure to properly receive, store, or use vaccines, could result in restitution. So our restitution policy is as follows. If it's the first incident, but the total loss is over $10,000 in value of vaccines, if it's the second or greater incident, regardless of total value, if it's due to a failure to immediately open a vaccine shipment that you receive from McKesson or Merck that results in the vaccines being deemed non-viable, or if you store a refrigerated vaccine in a freezer or a frozen vaccine in a refrigerator and those vaccines become non-viable due to that mistake. If your site were to be asked for restitution, you would be asked to fill out the vaccine replacement form that's just found on this slide. The vaccine replacement form does not contain any patient identifying information, so it can be emailed over to the vaccine unit, either the representative from the unit that has been working with you about that replacement, or to our general DPH inbox, which is found at the bottom of the slide, is also found later in this presentation. Just as a quick overview of the vaccine replacement worksheet, on the left side of the form, vaccines to be replaced, that would be the state supplied vaccine that the state is asking you to have a replacement on. And the replacement vaccine on the right side of the form is that privately purchased vaccine that you will be using as a replacement. So all providers must have a written standard operating procedure, or SOP, for proper vaccine management. The vaccine management SOP must be reviewed and updated annually, or whenever there is a change in responsible staff. What we recommend over the immunization division is that at least you update your SOP during the time of re-enrollment, which is typically in January of each year. However, if you fill out the SOP in January, then you have a change in coordinators in March, you will need to fill out that SOP again in March to make sure that it is accurate currently for your practice. Now, the SOP goes over everything from identifying vaccine coordinators, backup locations, how to store and handle vaccines, ordering, relocation of vaccines, handling expired vaccines, what to do in temperature excursions. So it's a really comprehensive document. All staff who are responsible for vaccines in any way must read their SOP and sign and date at the bottom. What we typically recommend is that a copy of your SOP is attached to your vaccine storage units that do store state supplied vaccines. That way it's easily accessible by anybody that is working at your site that might need to see it. So the vaccine management unit has included a vaccine management SOP template on our website. So we strongly recommend that you use that template to fill out your vaccine management SOP on a yearly basis. So one of the new things that we created was an addendum to that vaccine management SOP called the vaccine transport SOP. So this is also found on our website in those downloadable documents section. And this details the adequate protocols to handle and store state supplied vaccines during an emergency or a planned transport scenario. Now we'll go into this SOP in a little bit more detail later on in the presentation when we talk about transporting vaccines offsite. But first, let's talk about storage units. So all refrigerator storage units are required to be pharmaceutical grade. For a pharmaceutical grade unit, they're going to have an internal fans to move airflow. They're going to have adjustable wire shelving. There's going to be no storage bins or shelves on the doors. And they're also going to contain a microprocessor and electronic digital thermostat for temperature monitoring, temperature setting within the unit. If you do have any questions about whether a unit is pharmaceutical grade, you can always contact the vaccine management unit and we can help you out with that process. Freezer units do not need to be pharmaceutical grade. The one requirement for freezer units is that they are standalone units. They can be very small, they can be very large, but they have to be standalone. It can't be a combination unit where it's partial fridge, partial freezer. And anytime we talk about freezer units, I always like to mention that the Merck MMR vaccine should always be stored in a freezer. And we'll get into a little bit more details about that a little bit later. So the use of any household combination units or the use of a dormitory style unit is always strictly prohibited. In your vaccine management SOP that I was just talking about, where you identify a backup location, you have to make sure that that backup location does have a pharmaceutical grade refrigerator unit if you're going to be moving refrigerated vaccines to them. So they're going to have to fall under the same requirements as you do because they would be part of the program. So refrigeration units must be plugged directly into a wall outlet. So refrigerators and freezers, any storage units, they cannot be plugged into a power switch, a surge protector, an extension cord, a GFCI outlet, which is those outlets seen in the bottom right-hand corner of the screen with a little red reset button. And they also cannot be plugged directly into a generator or a battery pack. So it has to go directly from the unit into a wall outlet at your facility. So now inside the unit, one of the most important things is to clearly mark and identify your vaccines. So what is state supplied and what is privately purchased? As we talked about with the availability tables, There's certain instances where a patient may not be eligible for a state-supplied vaccine, and you have to use a private vaccine. It is very important that all staff are aware of what your state inventory is versus what your private inventory is. Also, unless otherwise specified by a manufacturer, sites should have water bottles in refrigerators or frozen water bottles in freezers, as these do two major things. One, they help stabilize and extend temperatures during a power outage, so it'll hold that unit even without power in range for a little bit longer. And then they also serve as physical blocks to prevent placement of vaccines in areas that are at high risk for temperature excursions. So if you put them at the very base of the unit, it will block from any staff accidentally putting vaccines on the floor of the unit instead of the shelves. So all vaccines except for varicella MMRV and Merck's MMR must be stored in refrigeration temperatures, which is between 2 degrees Celsius and 8 degrees Celsius. Varicella and MMRV vaccines can be stored from -50 degrees Celsius up to -15 degrees Celsius. However, it's very important to note that the diluent for any of those freezer vaccines cannot be stored in the freezer with them. They need to either be stored in refrigeration or at room temperature. There is a little bit of a sidebar here about MMR vaccines. So Merck's MMR vaccine is able to be stored from -50 Celsius to 8 degrees Celsius, meaning it can be stored either in a freezer or it can be stored in a refrigerator. The immunization division recommends that you store your Merck MMR vaccines in the freezer. That way, if there's a temperature excursion in the freezer, it may not even go out of range because it can go up to refrigerator temperatures. That being said, GSK's MMR vaccine can only be stored in the refrigerator, which means it can never be frozen. So if you're ordering MMR vaccines, please make sure you do know which manufacturer you're ordering from, so you do know the proper place to store those vaccines on site. So a little bit more about vaccine storage. Always keep them in the original packaging. Always organize them so the vaccines that are going to be expiring first are up front. So you do use those first and you won't be in the situation of potential restitution for those vaccines by letting them expire. Also note that overfilling the vaccine or frequently opening the door or leaving the door cracked can cause temperature excursions in your unit. So be really, really careful around the door and be really, really careful when packing the vaccine to make sure that air circulation is not hindered within the unit. Also, as a general reminder, never put food or beverages in the vaccine storage unit. Keep them strictly for vaccines. All vaccine storage units will be monitored with a digital data logger device. As a participant in the VFC program, the vaccine management unit will send you a digital data logger device. These are those yellow devices that we send that monitor temperatures. Every 2 years, the vaccine management unit will send out brand new calibrated digital data loggers for all of your vaccine storage units. In the situation where you want to privately purchase a digital data logger, it will need to follow these requirements. It will need to have that detachable probe. It will need to have an alarm to generate a PDF report where you can easily identify alarms, duration of alarms, minimum and maximum temperatures. So everything that our digital data logger device can do, you would need that private device can do. And if you do have any questions about whether your privately purchased data logger meets these requirements, please reach out to the vaccine management unit. We'll be able to look at it for you and make sure you're all up to speed on that. So digital data loggers are able to generate temperature log reports, which must be uploaded monthly. They also must be uploaded with every vaccine order. Anytime you are transporting vaccines off-site for like temporary storage or transport, and anytime the data logger reads an out-of-range temperature. So there's going to be a lot of instances where you're uploading the digital data logger temperature reports into MIS, especially if you're a new coordinator or you're training new staff on this. Being able to upload temperature logs into MIS is one of the key responsibilities that you should be aware of right off the bat. So in addition to uploading those temperature logs, the digital data logger device must be reviewed for the minimum and maximum and current temperature twice daily. So it has a set button and a read button. If you press the read button, it will show you the maximum temperature the unit has reached in the previous 12 hours. If you press it again, it will show you the minimum temperature the device has reached for the previous 12 hours. So if you're going in the morning, you're going to press that button 4 times because you're doing 12-hour cycles. That will get you back until the time range of when you left the day before. During the weekend, you might have to press it about 8 times in order to work through those days on the weekends. So it's really important, not only are you pressing the button, but that you are looking to see what those temperatures are reading. So if you see any out of range temperatures when you're doing this daily temperature check, you should immediately upload that temperature log into MIS and call the vaccine unit to report that out of range temperature while labeling that unit do not use until we get those viability results over to you. It is also a requirement that all providers do have a backup DDL available for them. What we typically recommend is that once you do get those new data logger devices in that 2-year cycle, you keep those old devices as a backup at your site. If you haven't received a backup, if you throw those old data logger devices away or they're no longer good, your site will be required to privately purchase a data logger device that you can use as a backup in case your primary one suddenly stops functioning for any reason. So again, this is just an example of what that data logger device looks like. That read button I was talking about is the one on the right-hand side of the screen there. And again, please report all vaccine storage and handling issues as soon as you're aware of them to the vaccine management unit. So temperature excursions, when they do occur, immediately halt the administration of vaccines stored in the unit and then label those vaccines as do not use until those viability results are provided to your site. Your site should always upload the temperature logs as an urgent temperature issue in MIS, and then also give the vaccine unit a call at the number provided below. And again, a temperature excursion, even if it's for 0.1 degree over, 0.1 degree under for 1 minute, even if it's just 1 minute, viability could be impacted on specific vaccines. So you always must report these to the vaccine unit so we can make sure those vaccines are still viable at the time of administration at your site. So if you ever were to get vaccines and the viability comes back and it's no longer viable, you will need to report a storage and handling issue in MIS. So what you would do is immediately remove those vaccines from the storage unit. You would label them do not use, and you would package them in a box for return to McKesson. Now, since these vaccines are either going to be expired or they're damaged or they're not viable, you don't need a package with any temperature controllant. It can just be packed in a standard box and packed up for return to McKesson. Once that storage and handling process is completed and processed on the vaccine unit side, you will get either an email or the UPS driver will show up at your site with a return shipping label to slap on that box and get those vaccines moved out. Again, as a reminder, if the vial is open, contaminated, shattered, already pulled into, drawn into a syringe, it will not need to be returned, but should be disposed of in medical waste at your facility. Again, these are just screenshots about filing, storage, and handling issues and where to find them in MIS. To report the issue, you hit that gray report an issue button in the top left-hand corner of the storage and handling screen. It's very, very important when you're filing storage and handling issues that you're selecting the appropriate issue type. There is a bunch of types in there, so please take the time to find the one that is most appropriate to the situation that your site had faced. And you also have the ability to enter a short description in that text box below for a little bit more information that you think the vaccine unit may need to know when you're looking through and processing your storage and handling issue. If the vaccine unit does have any questions about the storage and handling issue you submitted, they will contact you directly about that. Now we're going into transferring vaccines, so moving vaccines off-site. One of the best ways to ensure that you're not expiring vaccines is to keep a close eye on your inventory and noting when vaccines are going to expire. MIS has a color coordination, your MIS inventory showing you this. So we highlight in orange or yellow saying you have 60 days, you get 90 days to use these vaccines before they expire. Once it goes red, the vaccines are no longer viable and a storage and handling issue should be filed. Providers should always aim to have no expired state-supplied vaccines. If you do expire state-supplied vaccines, there's always a chance that you may be asked for a restitution or replacement of those vaccines. What we typically recommend is your sites will know if you're going to be able to use these vaccines or have a general idea if you're going to be able to use these vaccines based on appointments, usually about 2 to 3 months prior. So if you're looking 2 to 3 months prior and you're like, I get 10 doses of HPV, I don't think I'm going to be able to use all of these, contact the vaccine unit or contact sites in your provider network and ask for help to be able to move those vaccines offsite to another facility that might be able to use them. And again, if you are transferring vaccines, and a provider site does agree to take them, please make sure that a transfer is always entered into MIS. That way, both your inventory and the receiving site's inventory always stays up to date. So whenever you are transporting state-supplied vaccines out of your site, you should always make sure you contact the vaccine unit for relevant guidance and advice to your specific situation that you're going on. Providers also must follow the CDC packing for transport guidelines. That is linked here on this slide. We'll also go into it a little bit later as we talk about the transport SOP. But these guidelines go over what you need for a proper transport. So frozen water bottles that you can condition, bubble wrap, corrugated cardboard, a hard shell cooler to be able to move those vaccines in. If your site is transferring all of your vaccines in your inventory, whether it's due to an extended power outage, there's a flood at your site, construction's going on, but you got to move vaccines out, you should always move your primary data logger if you're going to be moving all of your inventory. If you're just moving a dose or two to another site due to need or to move it before it expires, you can use your backup data logger for that transport. But regardless, a data logger must be used anytime you transport vaccines. So again, this vaccine management transport SOP addendum highlights all of these specifics and plans for when you are going to be moving vaccines. Vaccines always must be monitored with that digital data logger. And when you're setting up that cooler, so you're going to prep the cooler with the materials to make it cold for transport. You got the cardboard in there, you got the bubble wrap in there, and then you have the data logger probe in there to measure temperatures. Never put the vaccines into that cooler until that data logger is reading in range temperatures. So it may take a couple of minutes for it to get in range. So always make sure you're waiting until that is in range before you put the vaccines inside. And then again, never transport refrigerated vaccines on frozen ice packs. It's way too cold for the vaccines. And it's almost a surefire way to lose vaccines to a temperature excursion because of it. So transport methods are going to differ between emergency transport and planned transport. So you're probably asking, what is planned transport? So planned transport would be if your site's like hosting an offsite clinic, if you have satellite facilities that you regularly bring vaccines to, if you're relocating stock because of like a planned construction at your site, that's all known in advance as planned transport. So as described in the SOP, there are 3 different transport methods. There's the portable vaccine storage unit. So this is a purpose-built storage unit that requires active power source to function. So it would plug in to like a battery pack or a car battery to be able to keep temperature within the unit. There's also the qualified container and pack outs. You guys might be familiar with this. As this is typically what you would receive a vaccine shipment in. It typically uses those cold plates to keep vaccines cold and doesn't require any active power. The last method, which I referred to earlier, is the conditioned water bottle transport system. The conditioned system should really only be used in emergencies, or if it's a planned transport, until your site can purchase one of the other either qualified container and pack out or portable vaccine storage units. So when packing vaccines for transports, always pack your refrigerator and freezer vaccines separately. They're stored at different temperatures. They should be moved at different temperatures. And also label, are they refrigerated vaccines or freezer vaccines? So there's no confusion upon arrival. Always make sure that you separate the vaccine from those conditioned water bottles if you're using that emergency transport method with a layer of cardboard and bubble wrap. Never place them directly on the frozen water bottles. And also never use dry ice for transport of frozen vaccines. It's just too cold. So this page here is what that CDC transport guide looks like. It tells you how to condition a water bottle. It tells you how to pack the cooler. Essentially, when you're packing the cooler, I like to think about it as like you're making almost a vaccine hamburger. You have the conditioned water bottles in the bottom, a layer of cardboard, bubble wrap, and then you're going to have the vaccines in that glycol probe. And then you do the same thing on the other side where you go bubble wrap, corrugated cardboard, and then conditioned water bottles at the top. Typically, if the water bottles are conditioned appropriately and there's enough in there, this can hold temperatures for usually about 6 to 8 hours, as long as it's not getting opened and closed frequently. So anytime vaccines are transported off-site or moved out of your storage unit is considered a temperature excursion. So whenever you're moving vaccines and it arrives at the site, don't administer the vaccine until you contact the vaccine unit. You're going to upload those temperature logs so we can take a look at the data, and also let us know how long were they in transit for. When were they taken out of the refrigerator or freezer at your site? And when were they put into the refrigerator or freezer at that receiving site? With that information, we'll be able to run a viability check for you and let you know if those transported vaccines are now safe to administer. Power failures and outages can happen kind of at whim. If the power failure happens and is over 3 hours, then you should follow your transportation procedures listed in your vaccine management SOP and move those vaccines over to your emergency storage location as defined in your SOP. If the power failure is 3 hours or less, the best method to use is to just keep those vaccines in that storage unit. Even if it's not getting power, if that door is left closed and it's not being opened, if it's a pharmaceutical grade unit, it's going to be able to hold in range temperatures. It's much more likely that vaccines are deemed non-viable and lost to an excursion if you try to move the vaccines, rather than to just leaving those vaccines in that closed storage unit at your site for that 3 hour period. And again, once power is restored, upload those temperature logs into MIS and halt using those vaccines until you get those viability results. How do you vaccine order? So to place a vaccine order, you will hover over the vaccine tab in MIS and select the order option. You'll then select create a new order in the upper left-hand corner, and then you will be asked to print your vaccine inventory worksheet. So as you print your inventory worksheet, also take a look in MIS, see, are there any expired or damaged vaccines that I still have in my inventory that I haven't reported in MIS yet? If so, file a storage and handling issue for those vaccines. Then you're going to be reconciling your inventory. So this is basically making a double check that your MIS inventory directly correlates to what you physically have in your unit on site. If you have run into any problems with the reconciliation progress and your inventory is off, please contact the vaccine unit, as it's much easier to fix reconciliation issues before you reconcile than after you reconcile. Once you've done that, you'll be able to input your vaccine request and any notes. You'll upload your temperature logs for all of your storage units, confirm your shipping address and hours for where those vaccines are going to be shipped and when they should be shipped, and then you hit submit. So the screenshot below shows what your request page looks like on the vaccine ordering page. So on the request page, there is a recommendation value. Please note that this recommended value is calculated with the assumption that you are placing an order every 28 days. So if you place your order 45 days since your last previous order, it is likely that the recommended value is going to be an overestimate of your vaccine usage at your site. So if you ever see the vaccine unit reduces the request, that is because the recommended request might not align to your site having a 2 to 2.5 month inventory, and your order is being reduced to make sure you're not over ordering vaccines. Once you place an order, always alert staff to say, hey, we're going to have a vaccine shipment that's probably going to arrive in 1 to 2 weeks. When the shipment arrives, open the box immediately, check the temperatures, make sure they're in range, and then go through that packing step and make sure what you ordered and what's listed on the packing step is what you got in the shipment. If there are any issues during this, with the temperatures or the packing steps not matching, contact the vaccine unit for assistance. Now, to quickly go over billing and charging for state-supplied vaccines. So sites can charge a vaccine administration fee up to $23.29 per vaccine dose for non-Medicaid VFC eligible patients. And again, this is per vaccine dose, not per antigen. You can always charge less than this vaccine administration fee, but you can never charge more. You can also never charge for the cost of any state-supplied vaccines or deny state-supplied vaccines to a patient that has an inability to pay the administration fee. Since January 1st, 2020, providers may only issue a single bill to the patient within 90 days of the vaccine administration for that administration fee. Patients cannot be turned away or reported to collections for an inability to pay the vaccine administration fee. So it's a one-time bill, and if they can't pay it, it cannot be sent to collections. Now, to quickly touch about the VIS and consent. So all providers are required to have provide copies of relevant and current edition of the VIS produced by the CDC before administering doses of vaccines. The most up-to-date versions can be found at these websites below. You can also sign up to get updated emails when the VIS gets updated. Some EHRs may even allow you to get updated digital copies into your system as soon as they happen. So really make sure you are staying on top of keeping the vaccine information statements up to date at your provider practice. So we mentioned a couple times during here documentation for keeping it for 3 years. So what kind of documentation are you keeping? You're keeping your VFC eligibility documentation, temperature logs. Now these are maintained in MIS, so you don't need to worry about keeping another copy at your site as long as you're uploading them into MIS. All packing slips for state supplied vaccines, your SOPs, your transport SOPs, replacement forms, action plans, the compliance certificates that you're going to be getting after today's webinar. Anything related to the VFC program needs to be kept for at least 3 years. Now, one of the other websites that I would highly recommend bookmarking on your computer is the VAERS website. So any adverse events that do happen when administering a vaccine should be reported to the Vaccine Adverse Events Reporting System, commonly referred to as VAERS. So hopefully this never does happen, but if it does happen, it's always good to have this bookmark so you can get that reported as quickly as possible. Now that we've talked a lot about the guidelines to compliance and the different roles and responsibilities, let's talk about what are the specific roles of the medical director and the vaccine coordinators. So the medical director is ultimately responsible for ensuring that state-supplied vaccine is administered within compliance of the program and the guidelines to comply. They're also responsible for ensuring that annual re-enrollment is completed in order to receive vaccines. Understanding that the immunization division staff are required to make site visits as part of the VFC program. And they're also responsible for designating a primary and backup vaccine coordinator. And if one of those staff members were to leave that was a vaccine coordinator, it's on the medical director to name the person who's going to be replacing them. Any changes in the vaccine coordinators must be reported to the vaccine unit within 10 days of that change happening. So the vaccine coordinators are ultimately responsible for the day-to-day oversight of vaccine storage and handling, ordering, inventory management, and acting as the shipping contact within the MIS for all state-supplied vaccine shipments. They're also responsible for commuting the vaccine policy and availability and all these updates that the immunization division is sending to their staff that are working under them. So again, these are very, very large roles with large responsibilities, but the immunization division is here to support you as you take on that role if you're new to it, to give trainings or any support and help that we can give you. So I've mentioned a couple times, re-enrollment is a requirement, happens annually every year. It's usually about mid-January to the end of February. It's all completed through the MIS. When you go into complete re-enrollment, you're going to be providing information about your practice profile. So how many children do you see at your site? How many VFC eligible children do you see? Confirming your shipping address, confirming your contact information for your vaccine coordinators, your medical director, confirming your MCSR license number. And I'll get into MCSR in just a minute here. It was new in 2023 as a requirement for re-enrollment. Also, importing all of the providers that work at your site, making sure your medical director has reviewed the agreement to comply and has checked the checkbox in MIS to make sure that your site is in compliance. If you're missing any of these steps, your re-enrollment will be denied and you'll be followed up by the vaccine unit immunization staff members to let you know this is what you are missing. Can you please fix this up? And then we'll work on help getting you enrolled. So the MCSR license number, or Massachusetts Controlled Substance Registration Number, is a requirement for all new enrollment and re-enrollment in the state vaccine program. So this license number is updated on a yearly basis, needs to be renewed on a yearly basis. So even if you're a new coordinator and you're like, I've never heard of this before, somebody at your site must know about the MCSR. So act around, ask your medical director about it. The MCSR license is essentially what allows your site to receive shipments of vaccines to your facility. There are two types of license numbers. There's a facility license number and an individual license number. The facility license number is tied to the facility itself. Now, this option is always preferred because it's tied to the facility and not an individual. On the other hand, an individual license number is tied to an individual at your site. So if that individual were to leave mid-year, you would no longer be able to use their MCSR license number on your enrollment page, and you'll need to work with the vaccine unit to get that changed up. So again, individual and facility are both absolutely approvable, but if you do have a facility license, it's always preferred that you do use that one, as it can just make it easier on the back end in case there ever are changes. Sites are also required to have VFC compliance site visits with them. So our quality assurance team will go out and conduct a site visit. These typically happen every 2 years, and they are assessed for, your site is assessed for compliance with the VFC program and other federal requirements and MTPH guidelines. Once the quality assurance analyst completes the site visit, they will provide you with a follow-up plan. So this will identify anything you're out of compliance, different steps to take to make sure you get back into compliance, and something you should take very seriously, and something that you should try to address as quickly as possible by your site. You're also going to get an acknowledgement of receipt that must be signed by your medical director or your listed medical director in the MIS, which essentially acknowledges that the site visit had taken place at that date with your facility. In addition to the regular VFC compliance site visits, the MDPH is also required to complete a certain number of unannounced site visits. So an unannounced site visit is a shorter version of a compliance site visit. And what will happen is a quality assurance analyst will show up unannounced for your site and do a version of the site visit with your provider practice with the same thing, where there may be follow-ups to do afterwards or acknowledgement of receipt of that unannounced visit. By agreeing to be in the program, you also agree that you may have an unannounced site visit sprung on your facility. The vaccine management unit also sends out monthly updates with new information and important updates about upcoming dates, important events, big changes. So please make sure that you are reading these vaccine management updates where they do come in. All the information that is included in them is very, very important for sites. If you do have any questions, this slide here, I'd even recommend, once you kind of download the PowerPoint after, printing out this slide and kind of keeping it on your desk or in a place that is reachable by staff members, as it includes all the information for the different units with inside the immunization division. It includes their contact information, also a little brief description about the things that they can help you with. Now, we're all part of the immunization division. So if you end up calling one of the units, they're not able to help you, they will get you transferred over and into contact with the unit that would be able to best assist. So please kind of bookmark this page, print it out, and keep it for reference for you. I'd also like to just go over a couple additional resources we have. These resources are super, super helpful for new staff members or new vaccine coordinators. First off is the Berlinger page that includes support videos for how to work the digital data logger device. I believe it's a series of 9 videos, each about 1 to 2 minutes long. So it's really only 15 minutes if you're going to watch all of them. And they go over all the different capabilities that this device has and how to use the device. So very, very beneficial for new coordinators. Also, I'd like to highlight the MIS does have resources. In the top right-hand corner of the MIS webpage, there is the MIS Training Center, which includes mini guides. Now, these mini guides are updated regularly, and they can include step-by-step directions for all different reports or functionalities or ordering, storage, and handling issues, step-by-step guides about how to complete these in the MIS. So again, for new staff members, it's a great thing to send them over to that digital resource center and have them review those documents. And lastly, I just want to mention the vaccine confidence product. So we're working to increase vaccine confidence throughout the state of Massachusetts to ensure that all residents are fully protected against serious vaccine preventable disease. To find more information about the vaccine confidence project, please visit the website that is listed on this webpage. And with that, that brings me to the end of my presentation.
Thank you for a great presentation, Dylan. We'll now start the Q&A session. Please submit any questions in the question box. So we've actually had questions flowing in, so we can start right away.
Great.
The first question is in regards to borrowing. So it says that Massachusetts provides vaccines to all children, regardless of insurance status or VFC eligibility. So if a child is not VFC eligible, I thought they could still receive the state supplied vaccine. So I think they're really just looking for what constitutes as borrowing or an example of borrowing.
Yes, exactly. So the reason why I also mentioned MenB during the borrowing is because MenB is pretty much the only vaccine that you are going to be borrowing because MenB, if you take a look at the availability tables, is only eligible for patients aged 16 to 18 that are VFC eligible. So it's a really small segment of the population that is eligible for state supplied MenB vaccines. Pretty much all other vaccines are eligible to those patients 8 through 18 years of age, except for MenB. It does have that additional requirement there. And that's why borrowing is usually only used during MenB, because you may not have the private or state stock for those patients. Yes.
Wonderful. And then the next question, are we responsible for damage to vaccines that happens outside of work hours or during weekends or holidays?
It would depend on the situation that happened. If it's, say, it's a weekend and your storage unit, just the compressor blows and nobody's there, you may not be responsible for those vaccines because there's not much anyone could do. However, if the cause of the excursion was like the door was left open over the weekend or something that the site was directly responsible for, restitution could be required. Now, I always like to put the caveat that any case of restitution or replacement is always looked at singly. It's always a case-by-case basis. So it's tough to make a general overarching call on restitution or replacement of vaccines.
And then if I expired vaccines but tried to transfer them to other sites, would I be responsible to replace those vaccines?
Again, it would be on a case-by-case basis, and it would really based on how long you had reached out for or when you had reached out. I would highly recommend always, if you're trying to reach out and move vaccines, always letting the vaccine unit know and reaching out to the vaccine unit. That way it can be documented these reach out attempts have been happening on our side as well. So when we review the case for those expired vaccines, we have all that necessary detail. Again, you should really be reaching out 2 to 3 months in advance if you know you're not going to be able to use vaccines before expiration. Because if you're only reaching out like a week or two in advance, it's very difficult to find a provider site that's willing to take those on and use them at such a quick turnaround. That's why we recommend reaching out well in advance to give that provider site that's going to be receiving them an opportunity to be able to use those vaccines.
If my site only orders state-supplied flu vaccine, do we need a pharmaceutical grade unit?
Yes, so any state supplied vaccine will need to have a pharmaceutical grade storage unit.
So this one's regarding transport. So if I am transporting just a few vials across the street, do I need to pack my vaccines with a data logger for that quick of a transport?
Yes, best practice is to always make sure that you pack the vaccines with a data logger anytime you are going to be transporting. Even if it's just across the street, if something happens on the way there, making sure that those vaccines are being monitored by that data logger. And again, if it's only a couple of vaccines, definitely use your backup data logger in that instance.
Can I store or ship VFC vaccines to other locations our site has to be given or used there, even if they don't have a VFC pin?
So if you're going to be moving VFC vaccines, you need to be moving them to sites that are enrolled in the VFC program. So you can never be moving vaccines to a site to administer them if they're not enrolled in the program. Kind of not really an exception, but a situation that could happen is your site might be running a vaccine clinic at a different location that's not in the vaccine program. But if that would happen, your site would be the running the clinic, your site would be responsible for those vaccines, and your site would be in possession of those vaccines, even though it's at an offsite location. But in general, you shouldn't be moving vaccines over to sites that are not enrolled in the program.
If we order MMR vaccine, how do we know if it will be coming from Merck or GSK?
So you would know that at the time of placing the order. So because we are a universal state, you have the option to also choose between manufacturers for vaccines that we are offering. So whoever does place the order, they will be able to know, like, are they placing an order for the Merck MMR vaccines, or are they placing for the GSK MMR vaccines? And if you do have any questions, you can always contact the vaccine management unit, and then we can follow up and let you know. If you were ever to receive a shipment and you were unsure at the time of opening that box, safest bet is to just put it in the refrigerator for the time being and contact the vaccine unit or contact your vaccine coordinator to ask which one it is. So if it ends up being the Merck MMR, you can just move them from the refrigerator to the freezer. And if it was the GSK MMR, it never went in the freezer to begin with.
So it looks like there's a few questions regarding the flu vaccine expiring soon. So what do we do if we have flu vaccine and it expires?
Gotcha. So the flu vaccine is going to be expiring at the end of the month. Once those vaccines do expire, you will file a storage and handling issue in the MIS to report those flu vaccines as expired. Flu vaccines, for expired flu vaccines, there's no restitution or replacement that's going to be required of them. Really, all we need you to do is to make sure that any doses you did administer over this flu season have been reported and decremented in MIS, and any expired or wasted vaccines are reported in a storage and handling issue. I also like to put the caveat out there that if your site were to order any flu vaccines before the end of this flu season, before 6/30, you're going to receive vaccines that expire on 6/30. So there's no pre-booking or pre-ordering for the 2023-2024 flu season. That ordering will open in most likely mid-August of this year.
Can we use refrigerated, not frozen cooling packs in place of water bottles?
You should be using the conditioned water bottles as the best way to move vaccines. The conditioned water bottles, as described in the CDC transport guide, essentially it's a frozen water bottle that you're going to run under warm water or put in warm water. And essentially what happens is there becomes a thin barrier of liquid water around an ice core. So if you were to shake the water bottle, you can feel that kind of ice core moving around. And that method is actually shown to be very, very effective at maintaining the proper temperatures for vaccines for extended period of times in those emergency situations.
So it looks like there's another question regarding of expiring vaccines and transfers, but kind of from the opposite end. So
Okay.
if a site accepts a transfer that's going to be expiring soon, but they're unable to use all of them before they expire, will they be held responsible for the restitution in that scenario?
Again, it is a case-by-case basis, but there's always the potential they could be. So what I would really recommend if you are on the receiving side of that situation, to make sure, look at your patient appointments that are coming up, to make sure that you are able to use those vaccines that they're going to be transferring over. But again, it's a case-by-case basis.
And then we have, are unannounced site visits completely unannounced, or will you have a sort of date range provided for them?
I believe they are completely unannounced.
Yes,
So
they are
yes,
completely unannounced.
so they will essentially, the QA staff will essentially just appear at your site one day and let you know that you will be having an unannounced site visit occurring currently, basically.
We do try to make them as quick as possible, so we are not aggravating your workday too much. And then we have a question about the MCSR. So they're wondering, why do they need this for state vaccines?
So the MCSR license number is what allows your site to receive shipments of vaccines. So even if they're state supplied vaccines, because the vaccines are considered a controlled substance, you will need to have this MCSR license number to be able to receive them. The website that's provided on that MCSR slide has a bunch of information and contact information for the MCSR office as well. And they will be able to kind of answer all in-depth questions you might have about that number, in addition to what the vaccine unit can provide about it.
And there are a few questions regarding data loggers, so I'm kind of going to group them together for you.
Okay.
So they're wondering if they are able to find out when they last received data loggers.
I believe the last time data loggers were sent out was the fall of 2021. So we're coming up on kind of the 2-year period now. So it's going to be kind of the fall of 2023 when provider sites will most likely be getting the new round of data loggers. And that kind of brings a point also to make sure that your storage units are updated in your MIS profile, because the amount of data loggers your site will be getting will be correlated to how many storage units that you have on site that store state supplied vaccines.
And then the second part of that, they're wondering if they have to request the data loggers or if we automatically send them out to them.
So they will be automatically sent out. However, if your data logger ever starts malfunctioning or your data logger dies, you can absolutely reach out to the vaccine management unit and request a new data logger be sent out to you.
And then we have a Men-B question. So if a 17-year-old has private insurance, but also has Mass Health as their secondary, should they receive privately purchased or state-supplied meningitis B?
Because they have Mass Health as secondary, they would still be listed as VFC eligible because it would be their secondary insurance. So they would, in that situation, be able to get the state-supplied Men-B.
And then also kind of following up on that, they want to know, do we know if Men-B will ever be added to routinely available vaccines?
That is a great question that unfortunately I do not know the answer to. But if that were to ever happen, I guarantee you will receive a bunch of communications from the immunization division letting you know about those changes.
And then we have an age question for VFC eligibility. Is it 18 years and 9 months or just 18?
It's through the age 18 year. So basically, once they turn 19 on their 19th birthday, they would be no longer in that category. So 18 years, 11 months, still able to get those vaccines.
I usually like to say that 18 years and 364 days, they are eligible.
Exactly.
Will MDPH replace private vaccines if they were accidentally administered to a patient who is eligible for state vaccine?
No, the MDPH will not replace any private vaccines.
And then this will be our last question since we are running out of time. But what is the difference between when you would use the vaccine borrowing form versus the vaccine replacement form?
Gotcha. So the vaccine borrowing form is really used for, say you have a patient come in who's VFC eligible, they're age 17, they're able to get a Men-B vaccine, but you don't have any Men-B vaccine on site because it's not a routine vaccine, you don't carry it, you only have the private. You could give them a private dose and then submit the borrowing form to replace because it would be a state supplied vaccine once you order again. So anytime the vaccine unit is going to be reaching out for restitution or replacement, or if there's situations with a borrowing form, we'll always make it very clear to you which form you should be filling out. 90% of the time when you're filling out a form, probably 95% of the time you're filling out a form, it's probably going to be that vaccine replacement form and not the borrowing form. The borrowing form is very, very rarely used unless we're talking about Men-B.
Thank you again for joining us, everyone. We hope you enjoyed the presentation. Keep an eye out for an email with a link to the evaluation. Just complete the evaluation for your VFC certificate. If you don't see the email this week, please check your spam folder, especially if you use Gmail. I know there were a lot of questions still pending. So if you would like us to follow up, please send us a note. We'll do our best to answer your questions. And again, thank you for joining us today. And we hope you enjoyed the presentation.